Yeah.
Okay.
There we go. And our internet is funny. Hello, how are you doing? What is going on? It's me, San Martin, and I am actually in a place that you guys all should know about. And one of the reasons why you should know about this place is because it helps out the community, it provides for the community, and it also assists the community. And I am actually here with a very special person, a person that was nominated because we want to go ahead and appreciate her. But without further ado, I just want to tell everybody who you are, and then I'll introduce everybody as soon as I'm done. When she's done. Anyways,
Okay.
tell everybody who you are.
Mimi Williamson. And yeah, I basically talk a little bit about my time in the Army.
Mm-hmm.
I was in from 77 to 80, and I was working in a small military hospital at Fort Eustis, Virginia. And basically, I was in charge of the mental health center there in the hospital. And I did a lot of counseling with service members, especially those coming back from Vietnam. And, I was right post Vietnam. So I did see a lot of guys that were, had a lot of trauma associated with being in the war, plus um, the not so good reception that those veterans had when they came back to the States. And so basically, you know, um, I just feel really grateful for the time I had. It was really the best professional experience of my life. I'm a social worker. I'm also a retired nurse, but I did go into the medical service corps as a social worker. And basically, I've been doing that all my life, psychiatric and clinical since then, retired. And I just want, that's all I have to say. I guess I'm really grateful for this
Oh,
opportunity for having won something. First time in my life I've ever won anything. So it's great.
Oh, well, you know what? You're a winner in our book, no matter
Thank
what day
you.
it is, even if you did not win anything in
Yeah.
general. One of the things that AZ MediQuip has actually brought to everybody's attention is that they're here in the local area in Prescott Valley. And one of the things that they need everybody to understand is that they're here to go ahead and assist. And we have Esperanza here. And Esperanza, tell everybody a little bit about the program and exactly what it what happens here.
So what we do here is we offer home medical equipment to patients in need. We are a retail store open to the public. Anyone's welcome to come in and purchase. What we did, am I doing the raffle? So what we did was we did a raffle out for someone to nominate a veteran in need, and Miss Williamson was the lucky one, which is a blessing, and I'm feeling very grateful and honored to
Thank
be
you.
able to participate and offer you something in a good need for you.
Great.
And not only is just a little bit, but it's asking for $500, guys. And I really do feel grateful to be a part of this. And now we have Amy, when she's like the marketing organizer here. Tell everybody a little bit how this all went down and if how long it took us to
Yeah.
figure this out.
I think a couple of months we've been working together. We, came up with the idea of, being new here in Prescott Valley. A lot of people know us in the Phoenix area, but not so much in Prescott Valley. And we wanted to, and everybody's been so welcoming in the community since we opened here in July. And we wanted to come up with a way to give back and show appreciation. We love our veterans, who come in and call us with questions, and just wanted to be really engaged with the community and connect with some great veterans and put it out there, to let's nominate someone. Let's, hear what people are doing in the area, what kind of equipment might people need, and let's work together. So it did. It took a couple months. We put the message out there to nominate. And then maybe a week later of getting in touch with our uh, the person we chose,
Yep.
and then we'll talk to the lovely ladies in organization who nominated
So
Mimi.
so
Yeah.
this is
Yeah.
how it all like evolved. We ended up having somebody nominate, and obviously they wanted to make sure that everything was kosher to go ahead and do so. But this is where it gets a little confusing. But with the same organization, we have Catherine and Kathy. So I think we distinguish it with actually Catherine. You go first. Tell everybody who you are and what this whole business is all about.
I'm going to let the boss describe the agency better. But as far as my involvement, I've been working as Mimi's care coordinator or case manager, as you wish, for at least a couple of years now at NACOG. And I actually worked with her in a previous position with one of the home care organizations. So I've known her several years now. And I'm the daughter of a vet, the wife of a vet, the mother of a vet. And when she was telling me about her work with returning Vietnam vets, it was like, this is somebody I want to push on out here.
Well, I appreciate you actually going out of, I mean, the way that, I mean, I don't know if this is what the organization all about, but why don't you tell everybody exactly what it's all about and why you do what you do?
Why I do what I do is that we are passionate about keeping seniors in their homes for as long as possible, to keep them out of the assisted living facilities. And there are over 600 area agencies on aging nationwide, and that is our mission. We provide resources, advocacy, and services for our homebound seniors and for our caregivers. So some of the services that Catherine would assess for would be Meals on Wheels, attending care, housekeeping, respite for a caregiver. We also have in our agency, we have caregiver support. We have support groups for caregiver. We have trainings for caregiver. We have the Ombudsman program, in which we're the ones that investigate any complaints or situations in assisted living facilities. We have a health and wellness program that's free to community members, to our seniors. There are evidence-based programs like Matter of Balance, anything to help our seniors stay healthy, happy, and safe in their homes. And we are probably the best known secret out there.
Yeah, I like it. Well, today is not a secret, and we don't want to keep it a secret. And we also have Diana here, which is a transport service from people who care. Do you care to tell anybody about a little bit of the organization that you work for or work with, or even if you're the owner?
There is no owner. There are volunteers that organize this whole charity, basically, for anybody who has lost their driver's license and can no longer drive themselves for medical reasons or whatever. And we make sure they can get to their doctor's offices, and any legal paperwork they need done, they call the main office, they call the volunteers that actually do the driving, and we take them where they have to go when they have to be there.
That is so amazing. So one of the cool things about what we are trying to do in our community is help out and also give everybody an opportunity to literally know what's going on here. And that's what we do here at the Prescott Times. I am so happy that you're the recipient of this. I'm so happy that you actually came down to the store here in Prescott Valley to enjoy this moment and to let us set up this, fine little thing going on here, to also talk to all the community. If you had something to tell the community, what would you share with them?
Just that I'm really grateful for this opportunity. I've never won anything before, and this is this is something I need, the things that I really need in terms of mobility and that sort of thing. So yes,
That's amazing.
I'm happy.
Well, I appreciate you. I appreciate AZ MediQuip and everybody that was involved in this. Maria, she's still over here in the back there. She's flagging everybody. Yeah. But anyways, guys, help out whenever you can. We always want to go ahead and reach out. So if you guys need something and you're in need, don't be hesitant to actually reach out to us. We'll try to lead you in the right directions. Obviously, there's a lot of cool people around this parks, and they're waiting to help you guys out as well. So with that being said, I'm out. Bye.
Bye.
Bye. Say bye, Instagram.
Okay.
What if I get a lot of likes? They'll be